It's a pleasure to be with you. The title of this session is Determinants of Public Health. There are no disclosures for this presentation. Objectives include discuss the definitions of health, review the determinants of health, discuss the interest and role of public health in addressing determinant of health gaps and deficiencies, review Maslow's hierarchy of needs in relation to the determinants of health and primary prevention, discuss racial and ethnic disparities impacting minority health, review the factors associated with premature deaths, discuss the ecology of health determinants and other factors that influence health. A statement written in 1988 by the Institute of Medicine's Committee for the Study of the Future of Public Health provides a mission statement for public health. The broad mission of public health is to fulfill society's interest in assuring conditions in which people can be healthy. That's a great statement, but what does the practice of public health, ensuring conditions in which people can be healthy, look like in the world in which we live? The causes of poor health are many and complex, requiring solutions that are also complex and diverse. Public health deals with this complexity by applying the concepts and principles of ecology, which views individuals as embedded within their environment or context. The ecological approach to understanding how health is either fostered or undermined is fundamental to public health practice. Before we can discuss the practical application of public health or practice of public health, we need to discuss the definition of health and conceptualize the complex set of factors that affect health, called the determinants of health. The most famous and influential definition of health is one developed by the World Health Organization, WHO, and enshrined in the preamble of its constitution in 1948. Health is a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. Although its constitution has been amended, this opening statement defining health has not been changed. Many subsequent definitions are equally broad, enlarging the definition of health beyond morbidity, disability, and premature mortality to include the sense of well-being, ability to adapt to change, and social functioning. Young wrote in 1998, "Indeed, the WHO definition is honored in repetition, rarely in application." This is partially due to the limitations and gaps of public health data beyond that readily available for morbidity, mortality, and disability. These data limitations and gaps subsequently result in limitations and gaps in public health strategies and programs to address the complete physical, mental, and social well-being of individuals. Though public health may define health broadly as per the WHO definition, other cultures may see health differently. A culture's or community's definition of health is important to know for community engagement programs, since these are the health issues communities feel are important and will invest their time and resources in. For example, many African tribes define health as harmony with self, others, nature, and supernatural or spiritual forces. With this definition of health, a person can have terminal disease and, if in a state of harmony, be considered healthy. There are myriad influences or determinants on individual and population health. Many feel that the discrepancy of health status worldwide is primarily related to healthcare access and service issues. Though healthcare access and services is one determinant of health, research and experience clearly demonstrate that there are many other factors or determinants that significantly impact the health of people worldwide, including the physical environment, health behaviors, primary prevention practices, individual characteristics, and the social environment. The lists under each determinant are not exhaustive, but represent examples of each determinant category. Although we use the term determinants of health, it may be more accurate to describe them as determinants of poor health, since they are more commonly used to identify unhealthy conditions. Determinants of health can be considered in several additional ways, as illustrated on this slide. Healthy People 2020 defines them as economic stability, neighborhood and the built environment, social and community context, health and healthcare, and education. Others describe these determinants as listed on the left side of this slide: economic, spiritual, emotional health, physical health and wellness, and education. No matter the terms used to describe the social determinants, the main point is that there are multiple factors or determinants that influence the health and wellness of people, and all determinants of health must be considered and addressed to improve the health and wellness of people. The World Health Organization states that many factors combine together to affect the health of individuals and communities. Whether people are healthy or not is determined by their circumstances and environment. To a large extent, factors such as where we live, the state of our environment, genetics, our income and education level, and our relationships with friends and family all have considerable impacts on health, whereas the more commonly considered factors such as access and use of healthcare services often have less of an impact. The context of people's lives determine their health, and so blaming individuals for having poor health or crediting them for good health is inappropriate. Individuals are unlikely to be able to directly control many of the determinants of health. The awareness of these health determinants justifies public health's focus on influencing the conditions and environment in which people live to ultimately improve their health status. Public health's mission is primary prevention. So why would they get involved in general education, economics, the built environment, agricultural practices, etc.? Shouldn't public health just focus on primary prevention messages and programs and let other disciplines take care of these other issues? Let's consider Maslow's work for a few minutes. This is a diagram of Abraham Maslow's hierarchy of needs. The lower four levels are described as deficiency needs, where the top level is termed growth needs or being needs. The basic concept is that the higher growth needs only come into focus once the deficiency needs are mainly satisfied. Physiological needs include such things as food, water, air, shelter, bodily comfort, and exercise, etc. The next level is safety and security. This is followed by the need for love and belonging, and includes socialization, friendship, sexual relationships, acceptance, etc. The fourth level is that of esteem, or the need for respect of others and self, and recognition by others. The top of the pyramid is the area of growth, self-actualization, and self-transcendence that relates to making the most of one's unique abilities, search for meaning, and future planning. Deficiency needs must be mainly satisfied before growth, self-actualization, or self-transcendence can be pursued. This is a list of attributes that describe self-actualizing people. They embrace the facts and realities of the world, including themselves, rather than denying or avoiding them. They are spontaneous in their ideas and actions. They are creative. They are interested in solving problems. This often includes the problems of others. They feel a closeness to other people and generally appreciate life. They have a system of morality that is fully internalized and independent of external authority. They judge others without prejudice in a way that can be termed objective. They're interested in planning for the future. Interest in primary prevention relates to future benefits for individuals, the area of self-actualization. People struggling to meet their basic deficiency needs at the lower part of this pyramid are not often thinking about the future. They're trying to survive in the present. Public health's primary prevention messages that relate to the future may not be very effective in these situations until deficiency needs are significantly addressed. The deficiency and growth needs listed on Maslow's pyramid are essentially the determinants of health, many of which fall into the deficiency needs area. To enhance interest in public health's primary prevention messages and programs, the deficiency needs of people may need to be significantly addressed. That's why the WHO stated that individuals are unlikely to be able to directly control many of the determinants of health and will need the help of others to meet those needs. Public health may not have the expertise, skills, competencies, and resources to address many of these determinants, but are well positioned to facilitate collaborations and partnerships around these issues. Let's briefly review a few determinants of health categories, starting with the physical environment. The physical environment includes both the natural and built environments. The natural environment of a geographic area includes the topography, weather, soil, water, animal life, and other attributes. The built environment is defined by the structures created for housing, commerce, transportation, government, recreation, and so forth. Health threats arise from both the natural and built environments. Common health threats related to the natural environment include weather-related disasters such as tornadoes, hurricanes, and earthquakes, as well as exposure to infectious disease agents that are endemic to a region, such as Plasmodium falciparum, the microbe that causes malaria and is endemic in Africa and other areas of the world. Health threats related to the built environment include exposure to toxins and unsafe conditions, particularly in occupational and residential settings where people spend most of their time. Some occupations expose workers to disease-causing substances, high risk of injury, and other physical risks. For example, the greatest health threats to U.S. farm workers are injuries from farm machinery and falls that result in sprains, strains, fractures, and abrasions. Other work-associated health risks include work-related lung diseases, noise-induced hearing loss, skin diseases, and certain cancers associated with chemical use and prolonged sun exposure. There are well-documented health threats to office workers from indoor air pollution found by research beginning in the 1970s, including passive exposure to tobacco smoke, nitrogen dioxide from gas-fueled cooking stoves, formaldehyde exposure, decay products from radon called radon daughter exposure, and other health problems encountered in sealed office buildings. In residential settings, exposure to pollutants from nearby industrial facilities, power plants, toxic waste sites, or a high volume of traffic presents hazards for many. In the United States, these threats are increasingly known to have a disproportionately heavy impact on low-income and minority communities. Let's now discuss the social environment for a few minutes, but start with a definition of the word society. A society is a group of individuals involved in persistent social interaction, or a large social group sharing the same spatial or social territory, typically subject to the same political authority and dominant cultural expectations. Societies are characterized by patterns of relationships, social relations, between individuals who share a distinctive culture and institutions. A given society may be described as the sum total of such relationships among its constituent members. In the social sciences, a larger society often exhibits stratification or dominance patterns in subgroups. The social environment is defined as our relationships with other people. These relationships occur at all levels of social interaction, including those in societies, communities, families, occupations, etc. The formal and informal rules that govern our social interactions at each level reflect the beliefs, values, institutions, and behaviors or norms of individuals or groups. These formal and informal rules have historical roots and govern how people live and behave, including how they develop relationships, distribute resources, and provide opportunities for societal members. This is a cultural egg diagram adapted from G. Linwood Barney's Layers of Culture, and is another way of visualizing the development of social rules. The behaviors of individuals, societies, communities, occupations, etc., are the result of deeper influences, as diagrammed by the white arrow in this illustration. It all starts in the center with deep beliefs, also known as worldview. These deep beliefs can be divided into four major categories: beliefs of self as human beings, nature, the supernatural, and time, past, present, and future. These deep beliefs or worldview inform the values layer, the things individuals and groups feel are important. These values inform institutions, the way things are done, like marriage, education, law, governance, running of businesses, etc. The influence of these deeper layers then emerge as the behaviors or norms of individuals, societies, communities, occupations, etc., including how they develop relationships, distribute resources, and provide opportunities for societal members. The process of developing societal behaviors and norms from the deeper layers of beliefs, values, and institutions results in informal and formal social rules that govern social relationships. Of particular importance to public health is the role of the social environment in affecting health status and producing health disparities. The Centers for Disease Control and Prevention, CDC, define health disparities as follows. Health disparities are preventable differences in the burden of disease, injury, violence, or opportunities to achieve optimal health that are experienced by socially disadvantaged populations. Some people are systematically disadvantaged because of their place in the social environment or their socioeconomic status. In a social setting that values certain characteristics, people with those characteristics are advantaged, for example, paid more, have greater access to resources including health care, have higher status, compared to those without them. In the United States and other Western countries, this status advantage is often indicated by a combination of education, occupation, and income or wealth. Persistent and substantial health differences exist between groups defined by socioeconomic status. Socioeconomic status is associated with significant variations in health status and risk for health problems for those having lower socioeconomic status compared to higher status individuals. There is significant literature demonstrating the relationship between socioeconomic status and health, including a gradient in which the higher the socioeconomic status, the better the health. The famous United Kingdom Whitehall study of English civil servants in the 1970s was one of the first and most influential to demonstrate the relationship between socioeconomic status and health. In this ingenious study design, participants were chosen to be similar in all but a modest socioeconomic gradient. Comparison groups were matched on ethnicity. They were all employed in stable office-based jobs and not subject to industrial hazards. They all lived and worked in Greater London and adjoining areas. The study found that within this relatively homogeneous population, there was a gradient in mortality, each group experiencing a higher mortality than the one above it in the hierarchy. The difference in mortality between the highest and lowest grades was threefold. Similarly, much research indicates disparities in health status between racial and ethnic groups in the United States. Minority Americans, including African Americans, Hispanic Latinos, Native Americans, and Pacific Islanders, generally have poorer health outcomes than do whites. The preventable and treatable conditions for which disparities exist between majority and minority Americans include diabetes, hypertension, obesity, asthma, and heart disease. Minority Americans also suffered disparities during the COVID pandemic. This graph shows the age-adjusted hospitalizations for COVID-19 based on race and ethnicity. Hispanic and Latino rates were highest at 425.9 age-adjusted hospitalizations per 100,000 population, followed closely by non-Hispanic American Indian Alaska Natives at 415.5 and non-Hispanic Blacks at 405.1. Non-Hispanic Asian and Pacific Islanders had an age-adjusted hospitalization rate of 127.0 and non-Hispanic whites of 100. This chart shows the cumulative COVID-19 age-adjusted mortality rates and disparities by race and ethnicity. The highest rates were seen in the American Indian Alaska Native, followed by Hispanic, Native Hawaiian Pacific Islanders, Black, White, and Asian populations. Racial disparities in health are linked to racism and the policies and practices within the social environment that express it. These policies and practices prevent or inhibit racial equity in health. The Centers for Disease Control and Prevention, CDC, explains it this way. Racism is a system consisting of structures, policies, practices, and norms that assigns value and determines opportunity based on the way people look or the color of their skin. This results in conditions that unfairly advantage some and disadvantage others throughout society. Racism, both interpersonal and structural, negatively affects the mental and physical health of millions of people, preventing them from attaining their highest level of health and consequently affecting the health of our nation. Non-physical occupational factors also affect health. For example, a great deal of research demonstrates the relationship between poor health outcomes and the psychosocial work environment. The demand control model is one well-known theory hypothesizing that employees with the highest psychological demands and the lowest decision-making latitude are at the highest risk for poor health outcomes. In addition, job loss, and threat of job loss also have a negative impact on health. Evidence suggests that transitions from employment to unemployment adversely affect physical health and psychological well-being among working-age persons. Significant research on the social environment and health, focusing on social integration, social networks, and social support has been done. For example, numerous studies over the past 20 years have found that people who are isolated or disengaged from others have a higher risk of premature death. In addition, research has found that survival from cardiovascular disease events and stroke is higher among people with close ties to others, particularly emotional ties. Social relations have been found to predict compliance with medical care recommendations, adaptation to adverse life events such as death of a loved one or natural disaster, and coping with long-term difficulties such as caring for a dependent parent or a disabled child. An understanding of the role of genetics in the development of disease is another tool in the public health toolbox for preventing and treating health problems. Knowledge about the effects of genetic inheritance on health is growing exponentially. Genetic diseases are caused by mutations of an individual's genes. There are several types of genetic disorders, including single gene, monogenetic, multifactorial, multiple genes, a combination of gene mutations and environmental factors, and chromosomal disorders, changes in the number or structure of chromosomes that carry genes. Genetic disorders can be inherited from family members, with others being random mutations. Genes can also be damaged from environmental exposures. With few exceptions, disease processes are determined by the interaction of environmental and genetic factors. A person's genes may make them more or less susceptible to a disease process. These effects can be measured by showing that the relative risk of exposure to an environmental factor is significantly greater or lesser for the subgroup with the abnormal gene than the risk in those without. The Human Genome Project, which began in 1990, advanced our understanding of genetics associated with diseases, suggesting the potential to personalize medicine, where diagnosis and treatment is based on a person's genetic profile. A 2011 National Academy of Sciences report called for the adoption of precision medicine based on genomics, epigenomics, environmental exposure, and other data. Of factors contributing to premature death, defined as death before 75 years old, 40% of those deaths are related directly to behavior and lifestyle issues or personal choices, 5% to environmental factors, 15% to social circumstances, and 30% to genetic predispositions. 10% of deaths are due to healthcare system deficiencies, which means that if the entire population had timely, error-free treatment, the number of early deaths would be reduced by only 10%. A major point is that health behaviors and lifestyle, personal choices that people make, are a major determinant of health, disease, and premature death, and influences the development of risky behaviors and even the self-management of chronic diseases. Premature death rates among Hispanic, non-Hispanic, Black, African American, and Asian Pacific Islander men and women declined steadily during the 21st century. In contrast, notable increases have occurred among young and middle-aged, non-Hispanic white, and American Indian Alaska Natives during the same time period, explained by increases in accidental, suicide, and chronic liver disease cirrhosis deaths. This century has also seen increases in accidental deaths as a result from unintentional drug poisonings, motor vehicle accident deaths, have declined. Opioid overdoses are a major contributor to the increases in drug poisonings, including prescription opioids, heroin, and fentanyl, despite recent policies to curb the opioid epidemic. The term health behavior can refer to behaviors that are beneficial to health. However, the term is generally used to describe behaviors that harm health, including smoking, using alcohol or other substances, failing to use seat belts or practicing other unsafe behaviors, making unhealthy food choices, and not engaging in adequate physical activity. The effect of health behaviors on health status has been widely studied and found to be an important determinant of health. The 10 leading causes of death in the United States in 2019, pre-COVID, in the general population were diseases of the heart, malignant neoplasms, cancer, unintentional injuries, accidents, chronic lower respiratory diseases, cerebrovascular diseases, stroke, Alzheimer's disease, diabetes mellitus, nephritis, nephrotic syndrome and nephrosis, influenza and pneumonia, intentional self-harm, suicide. These 10 causes accounted for about 75% of all deaths, and the first 2 accounted for approximately half of all deaths. Personal health behaviors influenced most of the diseases and conditions on this list. Another way of looking at death data is considering the underlying attributable factors that cause those deaths. In 1993, McGinnis and Fogey showed that as of 1990, the leading factors that caused death in the U.S. were tobacco use, dietary patterns, sedentary lifestyle, alcohol consumption, microbial agents, toxic agents, firearms, sexual behavior, motor vehicles, and the use of illicit drugs. As of 2002, the situation remained the same. This data makes the case for public health programs to change risky behaviors. Healthcare has an impact late in the causal chain leading to disease, illness, and injury, providing secondary or curative and tertiary care to those affected by disease, a downstream issue. Often by the time an individual interacts with the healthcare system, the determinants of health have had their impact, for better or for worse. Thus, the need for healthcare may be viewed as inadequacies of the public health primary prevention system. The success of a healthcare system to rescue people downstream is affected by other determinants of health and factors. This slide illustrates a few examples of those influences. The current status of healthcare technology and science obviously impacts the ability of healthcare to effectively diagnose and treat patients. A genetic predisposition to breast cancer may limit the long-term success rates of an individual's cancer treatment. Environmental exposures at home or work may decrease the likelihood that the physician can stabilize a patient with asthma. Health behaviors, such as smoking or substance abuse, may stymie the best healthcare system when treating an individual with heart or lung diseases. The lack of support at home may undermine the treatment of an individual with diabetes. Poverty, race, and ethnicity often limit access to healthcare, depriving individuals of the opportunity to be diagnosed and treated. So health, as well as healthcare, exist within a biological, physical, and social context, and all these factors influence the ability of a healthcare system to rescue patients. The determinants of health do not act independently of each other. They are interconnected, and the concepts of ecology provide the framework for understanding how to model their interconnectedness. The ecological approach means that people are viewed as embedded in their environment, both social and physical. People influence their environment, and in turn are influenced by that environment. Stokols outlines the history of ecology and social ecology, which are fundamental to the public health perspective and its practice. In summary, health is a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. There are myriad influences or determinants on individual and population health. Public health is well positioned to facilitate collaborations and partnerships around health determinant issues. Built environment pollutants have a disproportionately heavy impact on low-income and minority communities. Health disparities are preventable. 40% of premature deaths are related directly to behavior and lifestyle issues. The need for health care may be viewed as inadequacies of the public health primary prevention system. People influence their environment and in turn are influenced by that environment.